episode of Drug Talk. Today we're going to be talking about a medication known as Lorazepam, or more commonly known as Ativan. So Lorazepam falls into the class of benzodiazepines. There's many medications in this class, and there's differences between each medication. In this episode, we're just going to try to clarify the specific properties surrounding Lorazepam. There are several different delivery mechanisms in terms of dosage forms for Lorazepam, but usually you see it as a tablet. The tablets can be swallowed whole, or if it has SL on your vial, that means sublingual tablet, you would just place that tablet under your tongue and it would be absorbed under your tongue and through your cheeks. It's available as a 0.5 milligram tablet, a 1 milligram tablet, as well as a 2 milligram tablet. The 0.5 and the 1 milligram seems to be a little more common. The most common use for Lorazepam, or Ativan, is generally for anxiety. People can use it before they get on an airplane, if they have panic attacks, but whatever the case is, it usually comes down to anxiety. There are some other uses as well, so I'll name a couple of them for you now. Some people that use antipsychotic agents experience what's called akathisia, or uncontrollable body movements. Lorazepam can be used to help calm those down. When people are severely agitated, it can be used to help decrease the agitation that they're experiencing. It can be used in social phobias, and also it can be used with antipsychotics, or lithium, to help control agitation in people experiencing mania. So how do benzodiazepines work? So they actually non-selectively bind to different variations of GABA-A receptors, as they have some different subunits. When they bind to the alpha-1 subunit, that usually leads to sedation. And when they bind to the alpha-2 and alpha-3 receptors, they have more of an anxiolytic effect. That is, they decrease anxiety. Usually, benzodiazepines are prescribed for less than a 2-month period and only used as needed. However, occasionally they do have to be prescribed for longer durations of time. In the cases of long-term use, your clinician will explain early on the risks versus the benefits of using this medication. In terms of side effects, I touched on sedation earlier. See, most side effects that benzodiazepines cause are actually just an extension of that sedative effect, so fatigue or drowsiness. Some individuals can experience a decrease in their mental speed or their central cognitive processing abilities. Memory impairment can happen in individuals that are using this medication. Unfortunately, tolerance to this acute short-term memory loss does not develop over time. Excessive doses can lead to respiratory depression, and occasionally, usually only in older individuals, there can be some confusion or disorientation. Muscle weakness and headache can happen as well. The side effects I just named pertain to your central nervous system. Other than the side effects affecting your central nervous system, there are some other ones to note as well. There can be some anticholinergic side effects such as dry mouth or blurred vision. There can also be some sexual dysfunction, which would be decreased libido or sex drive, as well as erectile dysfunction in males. And finally, gynecomastia can happen in males as well, which is enlargement of breasts. Something else that can happen to individuals is something known as discontinuation syndrome. So when you try to stop the medication, you experience some side effects. Now, each benzodiazepine has a different rate of discontinuation syndrome happening, so it's something that you have to talk about with your physician and come up with a plan of how to stop taking the medication. Interestingly, up to 30% of individuals after taking an 8-week course of benzodiazepines, not necessarily just Lorazepam, but anything in the class, experience some of this syndrome. Now, the withdrawal effects from Lorazepam, since it's a shorter acting benzodiazepine, would typically happen in the first or second day of discontinuation. Withdrawal effects would usually present as agitation, insomnia, anxiety, perceptual changes, headache, muscle twitches or tremors, as well as loss of appetite and even delirium. Interestingly, you can also experience what's called pseudo-withdrawal symptoms. This is a psychological withdrawal, usually due to the apprehension in an individual when they know they're going to be stopping the medication. This would usually present as anxiety without the other symptoms that I mentioned in the discontinuation syndrome or withdrawal symptoms. If an individual was experiencing withdrawal symptoms from Lorazepam, again, remember, it's a shorter acting benzodiazepine, the physician would probably substitute with a longer acting benzodiazepine at an equivalent dose. And they would subsequently decrease the dose of diazepam, for example, by 10 to 20% every 1 to 2 weeks. This would depend on the patient's symptoms. When a tablet of Lorazepam is taken, the effects usually kick in within 15 or sometimes 30 minutes. Its half-life, that is, the time it takes for the concentration in your body to decrease by half, is 10 to 20 hours. It's a little bit longer in females. When treating anxiety, the daily dose is usually 1 to 10 milligrams divided in 2 to 3 daily doses. However, we usually see 2 to 6 milligrams daily, again divided in 2 to 3 doses taken throughout the day. For sedation surrounding a surgery, dosing will be based on the individual's weight. It can be given intramuscularly, and usually they would go to a maximum of 4 milligrams. When treating seizure disorder, they would usually use 4 milligrams per dose given over a slow IV drip. The maximum rate to give this medication in the IV form would be 2 milligrams per minute. You can repeat this every 10 to 15 minutes to a maximum dose of 8 milligrams. When treating insomnia associated with stress or anxiety, usually you would give anywhere from 1 to 4 milligrams. You would try to use the lowest dose that would help the patient achieve sleep. Before we end the episode, I'll just name a couple precautions to use before the medication would actually be taken or prescribed to or by an individual. It should not be used in people who have sleep apnea because they can cause physiological dependence, tolerance, and withdrawal symptoms. They should be used cautiously in individuals who have a history of drug abuse, as they may potentially abuse benzodiazepines. And also, as a precaution, you shouldn't mix benzodiazepines with alcohol, as they both cause drowsiness, and you would increase the amount of drowsiness that you would experience. That's all we're going to talk about today for this episode of Drug Talk, talking about Lorazepam, aka Ativan. Remember, if you'd like to support the channel and help see it grow, you can like the videos as well as subscribe to the YouTube channel. All right, so we'll see you next time. Take care.